Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and I have an awesome guest today. Me and this guest met about a year ago, and we hit it off and had dinner, and it was pretty awesome. I have Spencer Greer with us. I would consider Spencer Greer probably the grandmaster of coaching based on production and production growth. We've talked a lot over the years, and there's lots of subjects that you get coaches on: phones, on business, on growing your EBITDA, on a lot of this stuff. But I think at the foundation of all that, the fruit of it is production that turns into collections. And I think that there might not be enough coaches in the space on what you do in the op, what you do in the practice to optimize production to lead to collections. I think there's a negative connotation on this sometimes where older docs have a mindset of like, well, you're finding production that shouldn't be there, and that's unethical. And I think where it really is the spirit is finding production to help as many patients as possible get ahead of their dental problems. And I think production-based coaching isn't as heavy as it should be in this space. So Spencer just had an awesome milestone that I'll let him talk about, where he has a couple practices, and his one practice just last month reached an amazing milestone. I'll let him talk about that. But Spencer, first, what motivated you to take on coaching based on production? Because it is a smaller coaching niche.
I was looking at my numbers a few years ago and I brought them up to my coach and I just like, hey, look at the profitability of these practices. Are you like, I've got to spread this out. I've got to do something else besides just doing what we're doing in these practices. And that's when my personal coach, he goes, you've got to take this to the marketplace. So I just put myself out there and I told everybody, hey, I'm going to teach you everything I know in 3 hours, right? I'm just going to spitfire everything and you're going to get 80% and you're going to fly with whatever that. Pay me 500 bucks. And I had more than 30 people join me for that first thing I ever did. And the feedback was incredible. And I just kept getting message after message. They're just like, dude, this is exactly what I needed. That was amazing. And so I said, okay, I've got something here. The main problem that dentists have is we don't know what we have and we don't know what we don't have because we just sit in our own practices and we don't know. We're in this cage and there's so many opportunities out there. And, your typical your normal partner that you have on the podcast, he's always saying just like these amazing things that he's doing. And how are we ever going to know that people are doing amazing things if they don't put themselves out there? So that's why I started doing it. And financially, it doesn't move the needle for me. My practices are doing so great, and that's where I really provide for my family. But I know that if I add value to other doctors, it's going to be a win for me because I get to do some kind of a spin-off of my dental profession, and then they get a win because they get to produce more. So over the past couple years, I've been coaching hundreds of dentists on one thing, and that's producing more. And just to give you a little concept of how much we produce, this past month, my two offices over 16 working days produced $600,000 net between the two. And that might sound like, okay, whatever, but this was 16 working days. And for one office, it was the first time that they've ever averaged over $20,000 per day in that practice. And that was just one dentist and one hygienist. And they killed it. They crushed it. The dentist is making a massive amount. The hygienist is making an amazing commission, and the whole team is getting bonused beautifully. So it works. These things that I do, I mean, that guy graduated in 2022 and he did it all on himself. So I can teach people how to do that kind of stuff.
It's interesting. A couple things you said kind of hit me. One is about how you provide in the marketplace. I mean, Dental Unfiltered, our virtual study club we have, some of the webinars I do for other companies. Like I'm gonna teach for you this year in your course, and a couple others. Like I don't make money off any of that, and I just like providing good guidance and material that people enjoy in the marketplace, and it comes back to me. People like come to me and say, "Hey, let's do something together." Dr. Avi that does Invisalign stuff wants to do something with me. It does come back to you, and it's good investing in the marketplace. But anyway, so you said something being locked in a cage. So I feel like dentists are in a cave or like a mine, and the lights are off, and they have like a little flashlight, and they're kind of feeling around the dark. And every now and then they find like a nugget of gold. And I feel like if they turned on the lights, which is good production coaching, they could mine more efficiently and know where the gold is and where the gold isn't, and could create a system and a process and a strategy for getting more production. Right. So you were doing well. You were talking to your coach, and he said, you should do this. Your practices, I know for sure because of where I'm in the industry and the data I see, are in the top 1% of practices in the country. And a lot of times, a top 1% doc wouldn't have time for coaching. Andrew Vallow does not have time for coaching. So you making that time, you obviously have to enjoy it, and there's obviously a level of personal fulfillment that comes from it. You recognized the opportunity for this and started coaching it. When you went to your first doc and he was like, hey, I need help with this, what areas did you start him in looking at to pick up this new production? So you have your first coaching client ever, and he's this new doc, and you're getting used to it. And it's like, fundamentally, where do you direct them first? What's the first step you have them go look at to understand the production opportunities?
First thing is, what do you want to make? And it is just clearly writing down, what do you want to make? Well, I want to be $1 million practice. Okay, great. Do you know how much that means per month? No. I'm like, that should be when somebody slaps you awake, they should say, what's a million divided by 12? And you should say 83,000, right? And so that needs to be your pinnacle light of what you look at every single month. And you need to absolutely go after it 100%, 83 or bust. And so if you want to be that beautiful, hey, I'm $1 million plus practice, you've got to start there. And what's 83,000 per week? Is it like, yes, it's 20,000. Are you open 4 days a week? That's 5,000. Are you doing 5,000 at least per day? No, I'm not. I'm not really looking at daily. Okay. So that's exactly where we've got to start. And too many times people are just being in this falsified holy position of, I don't really care to make the money. I don't care if I get the money. I just want the practice to have the money. I say, do you even know what that means? Did you read that in a book or something? Because what does
These
that
are really
even mean to
common
you?
answers. I hear these things all the time, what you're saying,
Right.
all the
Right.
time.
And it's because people don't know what they don't know, but they're trying to put the facade out there like, okay, yeah, I'm a business owner. I know what I'm doing. But here's the thing is none of us are taught business in dental school. About half of a percent of people come out of dental school even knowing anything about business, and boy, are they just killing it, right? Well, how about the other 99.5% of us? We've got to learn as we go. And so therefore you have to start running. You have to hit that ground absolutely crushing. And I mean, being military ops, like sometimes, yes, you have to have the plan, but you've absolutely just got to keep going. You've got to keep the adrenaline up. And some people are just getting too passive. You know what? You know what I see way too much of, Matt, is people starting a practice and getting so excited about the process of starting the practice. And I say, you don't even know what you're getting into. You think that this is the process. It's not. You're about to start, right? Starting a practice is nothing compared to those first couple years. You have to absolutely go, and you're going to go gray, you're going to go bald, right? And it's going to be tough, but do you want to front load that process and get things cranking? So yeah, I think that figuring out what you want to make is the first thing. Second thing, sorry, you only asked me one, but I'm going to give you two.
No, go for it. No, no. Yeah, I want to access your brain. Go for it.
Number two is you're not diagnosing what you need to diagnose. Straight up. Straight up. People want to be liked more than they want to sell necessary treatment or products or services. They are too fearful that they are not going to be liked if they deliver difficult news or large numbers of money
Yep.
to present to the patient. So those are the two first places to start.
Yeah, it's interesting. You know, I feel like there's three issues with production issues. One is docs get into like a country club mode of like move at a certain pace and they say, I want to do more. But what they don't understand is that means like I want to go from $100,000 to $200,000 a month. I get this literally all the time. And it comes down to like, okay, well, are you willing to work twice as much or find more production in your current clients you're missing out on, right? Then the other one I find that happens is the fear. Like they look at like, okay, this patient needs these things. They need an implant supported bridge, they need a couple crowns or some drill and fill, and I'm just going to present the the crowns because the implant supported bridge, there's maybe some bone graft there, and that's going to be super expensive. And I'm scared to ask the patient for that money or explain it and tell them, and I'll just say, oh, we're going to do this first. We'll start with that later. And I feel like, I talk to docs about this all the time. And I feel like I'd love to hear your feedback on this because your brain on this is way bigger than mine. I feel like if you bring everything back to a certain truth, it can kind of refocus you on this. Your job, dentists, I'm not a dentist, is to do what's best for the patient all the time and get ahead of the dental problem. When we're scared and we do this, our fear drives us to provide substandard care and not get ahead of the dental problem. So I feel like if you refocus that to, well, am I doing what's best for the patient? The answer is no, you're not. You have to present everything. And you have to ask for the yes, and you have to drive towards production. Which one? So like, we have the fear and we have, let's call it lazy or a country club mode. Which one is the higher percentage that you see, or do they collide?
Fear.
Fear's bigger, right? I was gonna say the same thing. Clinical bravery is something that never gets talked about, man.
Because they're only lazy if they're comfortable with their finances, and most people are not comfortable with their finances. So, when do they get lazy? A couple years in, when they've found their norm and they're just fine with it. They've lived to be fine. Matt, do you ever want to live to be fine?
I'm the wrong guy to ask. I'll tell you why, because I do things differently today than yesterday. I do things differently today than right now than tomorrow morning.
Matt, I'm going to answer this question for you. Your Instagram handle is Matt's Amped Life. You do not want to be fine. You want to be amped. And so when people are finding their comfort zones, that's when they're becoming lazy. All right, so let's go back to previous when they're starting out as fearful or as they're continuing to be fearful. They fear the difficulty of that confrontation of, okay, is the patient going to be upset? Are they going to jump out of their chair when they see the number? All of these things drive fear. And you know what else does is when you have one experience that is bad, let's say you got a 1-star Google review. That is going to make so many dentists change. They're going to alter their behavior for all of their future patients because of that. So it is fear driven. Doctors are fear driven. And so, how do I allow them to produce more? Is I expose them to those fears, and then they can say, okay, this isn't really something that I should fear. It is okay. And rejection doesn't have to be bad. Rejection happens to everybody. Every girl that you liked in high school didn't like you back. That was rejection, right? Every door that you knocked on as a door to door salesman, that was me. They didn't buy. 29 out of 30 said no. You just keep going. And so, therefore, rejection in the dental practice will be normal. So, it's fear that we need to get over.
I have my own view on the rejection, and the clinical bravery and the rejection. I want to hear your view on it. So I feel like in dental, right? So let's say you're a door-to-door salesman, right? When they reject you, it's 100% rejection, right? But I feel like in dental, when the patient's in the chair, because the person whose door you're knocking on to sell solar panels or pest control, whatever it might be, right? Like they don't fear you. They just don't want to deal with you. You're a nuisance, right? But when someone gets in the dental chair, I think as dental professionals, we have to recognize that rejection in particular isn't really a personal rejection of us. They're rejecting dentistry. You know what I mean? Like
But nobody thinks that.
No, no, no one thinks that. No, 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 no one thinks that. And like,
Everybody thinks that it is a personal rejection.
yeah, everyone does. And I think you have to understand, like, I think it's like 80%. I'm just scared of the dentist, right? So when I teach case presentation training, I talk about like, a patient can choose to not accept treatment in the car driving over, in the parking lot, in the waiting room before they get to the chair, right? And like you have to understand, they might have chose to reject you before they ever met you, right? It's a very different rejection. I think if you're a doc and you think about it that way, it should lessen the pain of the rejection, right? And I think taking the path of least resistance on these production conversations just hurts everyone involved. Hurts doc, hurts the patient, hurts everybody, right? I can see how like you coaching to get through that. That's like the first layer of like asking for more production, right? Like we get past that. Now we can ask for it. Now we can inform better. Now we can move the patient down the road better because we've gotten rid of the fear of rejection and we talk more confidently in that scenario.
Having that realization for yourself is so key early on. And if you're a couple years into your career already, right now is okay to have that realization and just understand that people naturally don't like spending money on things that are not fun. And so that's okay. I got a question the other day. How do you do Invisalign cases? Because people just do not want to buy them from me. I feel like nobody wants ortho. And I said, hold on. I said, hold on. When's the last time that somebody produced or introduced something for $5,000 to you? And you automatically said, yeah, sure, cool. Like $5,000 is a lot of money if you don't have value tied to that thing that you're buying. So it has to be value driven, not dollar driven. They have to understand value before they see dollars. What is the value in Invisalign? Oh, you're going to absolutely never want to close your lips during a photo smile again, Matt. You're going to love, the way that you talk to people in social circles when your teeth are straight and you're not worried about that snaggle tooth. You're not going to have to worry about these new cavities developing, in these areas that are really hard to clean because we're going to take care of that for you within 10, 12 months. That is value before you bring up dollars. So
It's
when people are
personal. It's
scared to
personal
bring up money,
impact.
yeah,
Personal impact.
I think value is one way to synonymously say personal impact, right?
Yeah.
And so we got to drive that for the patient. And yesterday, I went into both my practices just to kind of see how I could help because I saw that for the last day of the month, both of them were absolutely cranking. So I don't produce anymore. I give all my production to my associates. One of them graduated less than 3 years ago. One of them graduated less than 4 years ago. They both make over $500,000. They're doing just fine.
And they have no
Now,
desire to go open a practice because they're doing fine.
I mean, who would want to start a practice when you would make
Yes.
the same amount of money with all the stress? So when I went in, I saw that one lady needed a consultation and she already went to two different practices. And so my first question was, why has this lady not said yes to treatment yet? What is it that they have not been in tune with, right? And so I went in with that question. What is it that she's looking for? And finally, I realized A, she didn't want implants. She didn't want to spend the money on implants. And so, okay, I'm not going to go into implants. But the main thing was she has a terrible gag reflex. And both places that she went to were saying she needs to take all of her upper teeth out and she needs to get a denture, and that's going to go all the way back. So she's really worried. Great. I thought of a great treatment plan, presented it for her, and she absolutely was thrilled at the price of only $6,000. Okay. So now her insurance paid 5,000, she pays 6,000 and she was pumped about it. But it's because I was listening to what is she looking for? Rather than me just being the doctor doing the doctor talk and just saying, well, your teeth, these need extracted. This one, here's a price, right? We have to say, what what is gonna help this patient to see value in what I can do and how they're gonna be able to pay for it. Great. She qualified for all of it with care credit. and we're moving forward.
So what you're really talking about is the human train first and the human currency of what happens. Like, navigate the human train, the clinical will come. The problem with you guys is you spend your whole time training on clinical train, and you walk in the operatory and there's an x-ray there and all this clinical stuff to prompt conversations, and you fall right into the clinical conversation, and you never navigate the human train first, right? You never do. You're talking about how you change their life through dentistry. um I think that's really overlooked, and this is another thing. So, and I would, you know, you know way more than I do. I'll do consult reviews and interview my docs. I get very involved with my dentists, and we'll do a consult review, and I'll go consult by consult with them that I provided, and they'll say something like this. I'll be like, tell me about this patient, and they'll say, well, I need to see the X-ray to know about the patient, and I'm like, no, you're not allowed to see the X-ray. Like, what do you mean? I'm like, you should be have a note somewhere in the practice management software that's even cliff notes of like going on 50th wedding anniversary, wants a new smile, like moved into the area, was a teacher, something like that of the human train. When you can only remember your patients by X-rays, you only remember the clinical part of your patient. You are failing on the human train. And that is something that irritates me when I deal with docs. I mean, tell me about the patient. They'll say, can I see the x-ray? And my answer is no, you're not allowed to. Where have you navigated the human terrain at?
Are you saying train like choo choo train?
No, terrain. Like the
Oh,
human terrain.
terrain.
Yeah, yeah, the human terrain. Like where have
Gotcha.
you navigated the human terrain and built the human equity and the human currency with this individual? I mean, they like it's
Yeah.
just so
So
clinically focused.
any doctor who's listening right now, I want them to imagine and to do this on their next consultation. I want them to sit the patient up. I want them to sit in a chair that is not right by their ear, right? Face the patient like 6 feet away from them, look at them and lean in. Put your elbows on your knees and lean in. Have that kind of a conversation with the patient to where you're actually engaged and you're physically listening. You're physically putting yourself into that listening position. That person will like you and want you to do their work. It doesn't matter how skilled you are, it's because you are showing that you are willing to listen and do what is important by them. Now, we're going down a different path than I anticipated because I don't really talk about this a whole lot, but this is such an important concept that if you want to produce more, you've got to be a likable, approachable, empathetic doctor, right? You have to be those things. And if you didn't catch those three things, rewind 15 seconds. You have to be likable, approachable. You have to have empathy. You have to have the goal of wanting to produce as much as possible because production is a direct representation of the amount of good services you are doing for your patients. And don't we all want to do a lot of good services for our patients? It is okay to talk dollars because production is a direct representation of doing that. Everybody who's a dentist and is getting paid to do dentistry and paying for their family's well being with dentistry should want to do more production.
Correct.
They're going to do well by they're going to do their family a favor, do themselves a favor, and they're going to do more patients a favor.
Correct.
Every time a dentist wants to improve at something, it is always for two reasons. If they want to improve in implants, if they want to improve in crowns or whatever, it's for two reasons. A, they want to better serve their patients. B, they want to make more money. It's the only reasons.
I think dentists also forget about this. Every metric or KPI in your like dentists, like we're talking about production. Let's talk about everything here. Every metric and KPI in your practice is a direct reflection of a human action. And I think like we look at the dashboard or we look at the reports for production and we like kind of focus on like, what could we have done better? But it's like if you get down to the granular actions of your day, what was missed? What could be there? Right? Like what is like where did I not pick up the slack? Like where did I miss out on opportunities, right? I think docs start to forget about that. Like, your production numbers are a direct reflection of like a human behavior, which is you in the operatory and all the things Spencer's saying. Like those behaviors culminate and they become production,
Yeah.
right? Like that's the sum of the behaviors is production.
Like it or not, if you became a dentist, you signed up to go into the people business
Oh, 100%.
primarily. And a lot of operators did not anticipate that. And some people overdo it. They overdo the people business and they talk and talk and talk. And they're just like, oh, great, Betty's here. I love talking about kids' baseball with Betty. And then they just get their fulfillment by having a conversation. And we're not therapists, we're not best friends, but unfortunately, too many dentists are making less money because they're thinking that a dentist should be everybody's best friend. You can be very efficient with what you're doing without being spending so much of your time being that therapist type dentist or that best friend type dentist.
If you work on your personality as a dentist, you can make a strong connection inside of 5 minutes that's memorable. And
Really quick.
yeah, and they'll realize that you care about like the thing you said about how close you get to them when you're explaining things and leaning in. When I talk in the operatory, because I mean, if you guys listen, I present live around the country. Like I as a owner of a marketing company with 80 employees and everything, I still live present because I want to stay in touch with what's happening in the operatories. And though I normally do, if I'm in the rolly chair, I get my right hip right up against the chair. I get about where their armrest is. So I'm like in line with them, looking at them where I can almost touch their hand. And I get right there. And that's where I do it from because it's harder for me to lean in with, with my leg and stuff. So I get right alongside them. And I usually move from being in one spot to move closer to them. The motion of getting closer when it's time to talk about this is a motion of like, I want to be with you for this. At least for me, that's what comes off for me is that. And I find that it does make a big difference. Like it really does. And, you know, going back to a couple of things that you said, it's one of those things where like, doc, like you can do it in 5 minutes, like whether you believe it or not. Now, this is my advice I give, and I would love for you to give your insight so I can change my advice since you know more than I do. Is when docs ask me how long they should be in the op, I tell them 15 minutes, 5 minutes human, 5 minutes clinical, 5 minutes setting up your case presenter. What is the perfect, because it is like docs, you have to realize this is what I say. If you're in there past 5 minutes, you have to pretend every minute past 5 minutes you're losing $1,000 a minute.
Mm.
Right? That's what I say because you're stealing a minute from your case presenter, and also your hands aren't moving somewhere else in the practice, and someone's waiting for you, and you're gonna have less time to work on that individual, right? So I like 15 minutes. From a production point of view, from a production expert like you, what is the best strategy to protect your production time and be in the operatory and connect with a patient? Like executable strategy.
Yeah, so you're saying how do you have the fine balance of doing a lot of production while also giving high value exams?
Like what is like the guide of how long I should be in there? What should it be structured like? Like if you coached me and if you coached who's listening in person in their operatory and they were taking too long, what would you say to them to make them understand that has to be shorter? And what is your standards?
Great question. I'm going to start with a little bit of 80/20. Let's figure out where the 20% is and just completely rapid fire those. So, your repeat patients, your low cavity type patients, make those exams super fast. You can go in with your good personality and you can be like, hey, what's up, Matt? Haven't seen you in a while. How's the leg? Is that a new titanium leg, Matt? And you can just be like, do 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 do. Hey, once again, no cavities. Hey, I just want my hygienist to put some fluoride around those crowns so you don't get any cavities around them. Otherwise, I'll see you in 6 months, bro. Good to see you. Right? You could definitely save your time because even though you're friendly, Matt, it doesn't make me handcuffed to the, oh crap, Matt is here and he always loves talking and I'm going to be in that exam for at least 10 minutes. That is definitely a production killer. Find those situations where you are not going to get financially compensated because guess what? This business needs financial compensation for it to run well, so you've got to think along those lines. Um So for those who are in for like a big exam, your schedulers need to see where those opportunities are, and if they're putting too many of them side by side with your big production columns, then you can go up to your schedulers and say, "Hey, you know, I really need to give these people a good amount of time. I don't need an assistant. We can do it during my lunch hour, or I'm always solid at 8 o'clock because those people are getting numb or they're getting, you know, scanned or whatever." You can be methodical and show your schedulers where the most optimal times would be. If you're having a 3 o'clock or 4 o'clock end of day full exam, and that's always when you're getting super, super busy, probably not a smart idea. So, um, being methodical with that is important, and tag teaming with your schedulers and with your treatment coordinators of exactly when that's opportune would be good. I was just talking to a guy that I coach, and he was just like, he put his head down. He goes, "I'm not spending a good amount of time when I get busy." And I said, "Hey, I get it. But as long as you're open with both of them and you say, "Hey, I'm going to give your jaw a break, and I just really need to do a really good job on this, and if your jaw is open for too long, it could cause you some pain for a few days, so I need to give you, I don't know, 10-15 minutes of just a break. So, let's get you your phone so you can just kind of scroll through that." Right? That's being intentional and leaving for a reason of your production appointment. And then with when you're with your full exam, if you're like, "Man, I really got to get back to my production," you can say, "Hey, I really want to make sure that we do this right. Your case is a little bit more extensive than I thought. I've got to just go finish something that I have over there. So while you're waiting for me, I'm going to have your insurance rolling," or you know, you can have an intention, you can have a reason. You've got to be creative, and you've got to give people a reason that you're leaving their room. Always give them a good reason that you're leaving their room and make it to their benefit. As you noticed, both times I just gave you examples, it was to the patient's benefit, right? But that way I'm able to to handle multiple things. You know, I had somebody come in an interview, and she was a salesperson. She's really great. She could be a great presenter. And then she's like, "All right, so let's have a working interview, and why don't you just line up a ton of consults, and I'll just come and do a ton of consults." And I go, "Man, I don't feel like it works that way in dentistry. Sometimes you have a tons of consults, but what if you have one day where it's like one or two, right? Every day is unpredictable. And so you've got to learn
I
how
mean,
to roll with the
you could
flow."
have a lot of consults scheduled and only two show too.
Totally.
Yeah.
Right. And that's why you don't put, when you talk in morning huddle about your consultations, you're not putting all of your effort into every single one of those because you don't know who's going to show up. Everything is a filtering process. And, you know, we have this many people who call, this many people who schedule, this many people who actually show up, and this many people who pay us for treatment. So it's it's definitely being on your A game every hour, every day. And that's why I don't think dentists should work 5 days a week, because every day that we work is really hard and it's really mentally engaging. And so you've got to really maximize every day.
I think there's a couple like faulty things. We have to wrap up here in a minute. There's a couple faulty things you guys think about. And I think you equate every missed day in the op to like $20,000, $15,000, $10,000 missed, right? I have a very close family member who's a dentist who I won't say his name, but he's a really good person to me, and I love him. And we go on vacation every other year as a family, and like he won't take the whole week off. And he's like, "Well, what about this? I can't miss the May days." And it's like, yeah, but you don't understand though, is like you are doing less production per day because you're not taking time to give your body a chance to relax, your brain a chance to relax, de-stress, decompress. You are not the best version of yourself for your patients every day. And if you did periodically take this time off and you did work 3 to 4 days a week, you would see higher production days and happier patients.
Yeah, I heard you and Andrew talking about this a few weeks ago, and I appreciated that fact, and I totally agreed wholeheartedly. Take care of yourself so that you, when you're in work, you can really maximize your work. That's all it comes down to. And every day and every week is not all about work. You're making plenty of money, hopefully, And if you're not making plenty of money, then you need to figure out how to maximize a day so that you're producing more in a day so that when you clock in and clock out, those hours are making you really good money. One thing that I highly disagree with is doctors who really focus on their daily minimums in their contracts with their boss. And what I always say is obviously, daily minimums protect associates to make sure that they have a good situation. But if anybody comes to me for an associate position and they say, "What's the daily minimum?" I say, "I don't have a minimum," because there's no way you're going to ever produce anywhere close to making the minimum. So everybody has the opportunity to just go into the office and say, "You know what? I want to take advantage of every opportunity that's in front of me, and I'm never going to have to think of this minimum again." Now, granted, there are situations where the office has not given you patience, and I get that. But you know where I'm coming from a high producing office. So, Matt, I think that we've left so much meat on the bone. We have so much that we could talk about, but I mean, this is just the start. Um, Dentists should give themselves permission to produce more dentistry and not feel bad about it, make more money, um, charge the patients the full fee. You don't have to give everybody discounts like you think you do. And you should be taking home more, and it's going to cause you to stress less and to enjoy life more. And that, my friends, is going to give you more longevity in your career.
Yeah, and just the back to taking care of yourself before we wrap this up. In the military, we carry what's called an IFAC, individual first aid kit. And it's this trauma kit that has like the stuff for a sucking chest wound if we're shot in the chest, has quick clot, has some really heavy duty tourniquets, all this stuff. And you never use your IFAC on someone else. You always use your IFAC goes to you. And the reason why is that you have to take care of yourself first. It's like when you're in the airplane and you're flying and they say you put on your oxygen mask before anyone else's. So you put yours on so then you can take care of your kids, right? If you don't put yours on, you could pass out and not take care of your kids, right? So you have to think about like your patients and your staff are your kids. Take care of yourself. You'll be a happier leader in the practice. Your team as a whole will be more productive. You'll have a better version of yourself for the patient. There's a lot here, and I think there is a lot more to talk about. Maybe we'll plan a second episode, but I think this episode's real theme was self management. So I'm able to have the most production. That really ended up becoming the theme of the episode. Like, how do you self manage from time in the operatory to making sure you're not burned out to everything? How do you self manage to be the most productive dentist I am for my potential? That's really what it was today.
Yeah. It all starts with the mindset of just saying, you know what? I don't want to make sissy money anymore. And that's okay. And I am giving myself permission to make a lot more money. And that's the self-management where it starts. And you just have to say, I'm going to be happier with my life because I'm going to make more money and I'm going to be more efficient about it. And if that means taking a day off, great. If that means taking a week off a couple times a year, awesome. Now, I I I totally empathetically understand how dentists have a hard time taking time off because we start out by saying, "Man, I just got to work on these student loans." And we really get after it. And it's a hard routine to get out of just like, "Hey, I work all the time." And sometimes work fulfills us and we're just fine because talking teeth and being dentists and working with our staff makes us happy. And I'm not really talking about that, but is dentistry fulfilling you in greater ways? Is dentistry giving you value in your life? Is it serving you or are you serving it? And if you're serving dentistry more than it's serving you, I would highly encourage you to reassess and pivot and figure out how it can serve you, right? And I don't think that there are many other professions where people take their professions so personally like we do in dentistry. We really let it define us. How about we use it to contribute to society, but we still live our own individual lives outside of it? In order to do that, you've got to make a good amount of money and you got to lower your stress levels. So that's my speech. We got to produce.
Got to produce, man. So Spencer, if I was, and we're gonna do, I think after having this, we're gonna do a second episode. Um, Spencer, if I was a doc, and guys, Spencer didn't pay for a sponsorship. We met, and his brain impressed me, and I wanted to bring him on the show. If I was a doc, and I was like, man, I need to become the best producing version of myself I can be, and I need a production strategy. How would they contact you to do your course? And I'm teaching in Spencer's course this year. How would they contact you to do it?
The best way is through Instagram. Yep. So, yep, High Level Dental Producers is the page where I talk about this and I go over my days and I show what my associates do and I talk about, tips and tricks of how to increase your production. But I hold a few courses per year and it's all digital. You don't have to fly anywhere and it's on Friday afternoons. And if you can't make it, it's recorded. Matt, I'm I'm plugging you into there so that you can add value to because it goes right in line of how to get patients to say yes more. So go to High Level Dental Producers. The next course starts pretty darn soon. I don't know when you're releasing this episode, but we start on March 6th.
This is getting front loaded in production. It's gonna be out as soon as possible.
Yeah, so we do start March 6th. I'll get a 10% discount code for anybody who listens to this and they can plug it in. It'll be Matt, MATT. That'll be our discount code for your listeners. And that way people just need to jump on the train and commit and invest in themselves. And this is an investment. It's not an expense. It's not something where you just say, "Oh, this is what it costs to do business." This is an investment, which is going to say, "I'm putting this amount of money and it's going to grow into more." And it's an investment in yourself and I'm here to make sure that it is a massive return on it. So March 6th, you can register with us and it's going to be 4 weeks and you're going to get 6 CE credits. Matt, when I met you in Philly at the dentist boost camp, I was like, I've never met somebody who definitely sees things the way I do. And you remember you were talking and we are just like, yep, yep, yep. I see things the same way. And I'm just like, hey, we we get it. We get it. And people who see our vision, they really fly with it. So I am super excited. Let me just tell you one thing. I just got this testimonial from somebody this morning, and she said she watched something that I posted, and she's joining my course starting next week. And I gave her my sprint. I gave her, as she purchased my course, I said, "Hey, watch my sprint, which is 3 hours." She said, "I did it last weekend and was able to double my normal daily average the last week of February." You weren't exaggerating the ROI. She watched me talk for 3 hours and she doubled her normal production.
Yeah, honestly, Doc, it's just a matter of thinking differently. So we're gonna wrap it up here. Guys, me and Andrew Vallow and all the hosts on Dental Unfiltered, the channel, Zach, Shelley, Kirk, Teach Out, Dr. Sasha. None of us get paid to do this. None of us do, and there's no sponsorships. No one pays for this. Energize, my company, kind of fuels this as a passion project for me and Andrew and the other hosts. And we actually have a team of like 4 people behind this that do production. So, hey guys, please do this one thing for us. Like, subscribe, share, follow, and leave a review. We love to read the reviews. Like we do read the reviews. That would really mean a lot to us, guys. Thank you for joining us. Thank you, Spencer, for joining us. It was great talking to you. And everyone have a wonderful day.
Thanks, Matt.
See you, buddy.